Okay, it says this thing is live. Alright. See if I can pull up YouTube chat. Okay. YouTube chat's up. Let's see. I just want to start off by saying that thank you to the person who's tipped me so much so far, donated. I really appreciate it. I did have issues with PayPal because something, uh, I thought everything was set up and it wasn't. So I think one of the payments got refunded, but um, everything else has come through and everything is set up for um, tips and donations through Streamlabs. So everything before, and the reason why it didn't really work, or the reason why I thought it wasn't working, is because when someone, I've never used this system before, and I've never I've never been tipped online. So when the tips were coming through on PayPal, it would just say pending, 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 and I looked it up, and it was yeah, PayPal payments, or money received from PayPal normally takes 21 days, and it has to go through this processing thing. It gave me instructions on what to do for the orders and stuff. So I went ahead and I did that, and was still in pending, and then I was waiting for it because it said it would take it was either 21 or 30 days or something for the payment to clear. So I was waiting for that, and on the 30th day of the first payment I have received, it said that this payment has been refunded, because what did it say? Because your PayPal is not verified, and I did everything to make sure that my PayPal was verified before I started setting any of this up. And it turns out that I needed to link a bank account to PayPal. So I went ahead and I did that. I thought I had a debit card on PayPal, and I thought that that was enough. Because I thought my PayPal was already verified, because it said verify your phone number, verify your email address, and so I did all of that, and I thought I was good to go. But that's what it was. It was because I hadn't linked a bank account, so I went ahead and did that, and all the payments just came right through. So thank you to the person that's donated so far. That really did help me out in paying a bill that I really did need to pay, for insurance. Anyway, so that's done. That's taken care of. And I'm guessing, I don't know, but I'm guessing any other donations that I receive in the future, they'll just come straight through. They should, because everything on PayPal is verified now, and it does say that things on PayPal, once you're set up and once you start receiving payments, or once you start receiving tips or donations, it comes straight through. So I'll have to see for the future where that goes. But as far as I know, everything should just work. Um, so I went ahead and I readjusted the amount tipped because PayPal sent back the like $10. That was the first payment that I had received. So I adjusted that. I think I think maybe I've gotten the YouTube sub counter to work. I'm not entirely sure yet, but basically, I think it was how I was set up and signed in on like Streamlabs, and it wasn't working because there's like two different logins for YouTube and Twitch on Streamlabs. So I wasn't able to. I didn't see that before. I went ahead and I've corrected that. So hopefully this counter down below the Twitter handle will pick up new subs that come in, and hopefully it's like automated. Anyway, let's see. Let's just get into this. I'm just trying something a little bit different today. So I'm in a lot of pain all the time. My back is constantly inflamed. And like nothing has really seemed to work for it so far. Like all the different medications I've been on, I've made like a bunch of videos about that, and you know, I just thought, maybe share this on like a live stream, and just watch a video together. This one is from the UK. It's not from like an American doctor, but still, I just wanted to watch it because everything that's like been found with me so far with like issues that I'm having has been like, oh, it's probably sciatic nerve. Even physical therapists have told me it's probably sciatic nerve because every single time they do any type of test on me, I do have an appointment coming up, but every time they do any type of test on me, they say that they find nothing physically wrong in my body, and they say everything is like structurally fine, which, if it's that, then good. If it's structurally fine. They haven't found any type of diseases. They haven't found any type of cancers so far. Within like, I don't know, probably a year of having tests done and running back and forth to doctors. So, I don't know what they're gonna find in the appointment coming up. Hopefully I'm able to get like more answers, but so far it's just been, yeah, you probably just have sciatic nerve, and I've looked up like stretches for sciatic nerve. I looked up medications that help nerve pain, and I've been taking so many different medications, and nothing has really like helped with that. But anyway, let's just get into the video.
Every now and then, we need a chance to escape from our studies. Whether you do that by busting a move on the dance floor, or taking a hike in the countryside to convene with nature, you need those leg muscles. Today, we're going to talk about one of the nerves that innervate the muscles of the lower limb, which is the sciatic nerve, and its branches. Before we begin, I'd like to give you a quick overview of what we're going to talk about in this tutorial. First of all, we're going to discuss the origin and location of the sciatic nerve. Then we'll take a look at the branches of the sciatic nerve and some other nerves of the sacral plexus.
Okay.
Lastly, we'll conclude our tutorial with some clinical notes about sciatica. Okay, let's get started with the origin and location of the sciatic nerve. The sciatic nerve originates from the sacral plexus, which we can see here highlighted in green. The sacral plexus is formed by the lumbosacral trunk, which consists of contributions from spinal nerves L4 and L5, as well as the spinal nerves S1, 2, 3, and 4. Here we can see S1 highlighted in green, and below it we can see S2, followed by S3, and finally S4.
Like, this area is where I have most of my pain at, also in like lower back area, and that's what they're saying. It's like it's probably that nerve that's going down.
Now we can see the
But
sciatic
it's funny
nerve
because I
in
don't
all
have
its
much
glory.
pain in my leg
It
besides
is
my
approximately
ankle.
2 centimeters wide and is the longest and thickest nerve in the human body. As I mentioned, the sciatic nerve originates from the sacral plexus. Specifically, it is formed by the anterior rami of spinal nerves L4 to S3. The sciatic nerve is a key nerve of the lower limb as it supplies most muscles and skin of the posterior compartment of the thigh, the leg, and the foot. Okay, let's take a look at the anatomical course of the sciatic nerve. The sciatic nerve exits the pelvis to enter the posterior compartment of the thigh via the greater sciatic foramen. If we add some musculature, we can see that the sciatic nerve emerges below the piriformis muscle. This is an easy way to identify this nerve. For example, for if you're in the dissection lab and you see a chunky nerve emerging below the piriformis, you're pretty sure to say that it's the sciatic nerve. The sciatic nerve then courses inferiorly through the posterior aspect of the thigh, and when it reaches the apex of the popliteal fossa, it terminates by bifurcating into the tibial and common fibular nerves. Okay, now that we're familiar with the origin and location of the sciatic nerve, let's move on to talk about its branches. It's worth noting that the sciatic nerve can also be described as two individual nerves bundled together in the same connective tissue sheath. As I mentioned previously, the tibial and common fibular nerves usually separate at the apex of the popliteal fossa.
Okay, so this is gonna
However,
stay
in
in like
some
the leg
individuals,
only.
these nerves can separate as soon as they leave the pelvis.
It's not gonna go into
Based
the
on
back
this
at all?
principle, we
Okay.
can see the tibial
still watch
division
it
of the
anyway.
sciatic nerve highlighted in green. In this illustration, we can see that the tibial division is formed by the anterior divisions of spinal nerves L4 to S3. The tibial division of the sciatic nerve innervates most muscles of the posterior compartment of the thigh, including the semitendinosus, the semimembranosus, and the long head of the biceps femoris.
I guess I shouldn't say, well, it's not like pain that I have in my leg, because it's like, it doesn't hurt. But every time like I sit and I try to do like leg stretches, especially on the left leg, like my leg will like bounce up and down. Like, it's really bad. It's so fucking tight that my leg will like bounce up and down. And I try to do stretches like every day. And that's why like right now, I think that's why right now like trying to touch my toes while standing hurts so fucking bad. Because that like my left leg is so fucking tight.
It also innervates the ischial part of the adductor magnus, which is a muscle of the medial compartment of the thigh. In the next image, we can see the common fibular division of the sciatic nerve, which is formed by the posterior divisions of spinal nerves L4 to S2. In the posterior compartment of the thigh, the common fibular division of the sciatic nerve innervates the short head of the biceps femoris. Okay, so assuming that the sciatic nerve does bifurcate at the apex of the popliteal fossa, let's take a look at its terminal branches. Here we can see the tibial nerve, which runs down the medial side of the posterior compartment of the leg. The tibial nerve innervates all muscles in the posterior compartment of the leg, which are the gastrocnemius muscle, as well as the plantaris, the soleus, the popliteus,
I thought the
the
first one was just
flexor
called the
digitorum
calf.
longus, the tibialis posterior, and the flexor hallucis longus muscle. In our next illustration, we can see the common fibular nerve, which is located on the lateral side of the leg. It's actually closely associated with the fibula, which is where it gets its name from. The common fibular nerve, however, is also known as the common peroneal nerve. The common fibular nerve provides sensory innervation to the posterolateral leg. Alright, so let's have a look at some terminal branches of the tibial nerve. Starting with the sural nerve, which is formed by fibres derived from spinal nerves S1 and S2. The sural nerve descends down the leg and is joined at a variable level by the sural communicating branch of the common fibular nerve, which we can see here. This nerve provides sensory innervation to the lower posterolateral aspect of the leg and foot. In our illustration, we can see two branches of the sural nerve. The first one that we can see is the lateral calcaneal branch. This branch provides sensory innervation to the lateral aspect of the heel. Next, we have the lateral dorsal cutaneous nerve, which is also a branch of the sural nerve. This nerve provides sensory innervation to the lateral aspect of the foot. We can also see how this nerve contributes to the innervation of the sole of the foot. Now back to the tibial nerve and its branches. Here we can see the medial plantar nerve highlighted in green, which...
Okay, so like on this side of the foot, like on the inside, I have so much fucking pain all the time on this ankle, on like the left ankle. I guess that's what this is that they're showing here. Like it just hurts so much, and when I went to the ER and I like told them all the pain that I was having, and they're like, "Oh yeah, this medication we're gonna give you will help with that," and it just doesn't. Like, I don't know what the fuck causes that. I don't know if it's like everything is just so, I guess, tension right now that it's pulling on something down there, but it always hurts, and it's fucking annoying.
which is a terminal branch of the tibial nerve. This nerve provides motor innervation to the abductor hallucis muscle, flexor digitorum brevis, flexor hallucis brevis, and the first lumbrical muscle of the foot. The medial plantar nerve also provides sensory innervation to the plantar surface of the medial 3.5 digits and the associated sole area, as we can see in our illustration here. If we have a medial plantar nerve, we must also have a lateral plantar nerve. This nerve is also a terminal branch of the tibial nerve and provides motor innervation to the abductor digiti minimi muscle, the flexor digiti minimi brevis, the interossei, the adductor hallucis, and the second to fourth lumbricals. It also provides sensory innervation to the plantar surface of the lateral 1.5 digits and the associated sole area. The last branch of the tibial nerve we're going to talk about is the medial calcaneal branch. This branch provides sensory innervation to the medial aspect of the heel and associated sole area. Now it's time to find out what happens to the common fibular nerve. The common fibular nerve divides into two terminal branches. We can see the first one in our illustration, which is the superficial fibular nerve. This nerve provides motor innervation to muscles of the lateral compartment of the leg, which includes the fibularis longus and the fibularis brevis muscles. It also provides sensory innervation to the skin of the lower leg and the dorsum of the foot. We can't see the next branch in our featured illustration for this tutorial, but it wouldn't feel right not to talk about it. So here we have the deep fibular nerve. The deep fibular nerve is a terminal branch of the common fibular nerve, and as we can see, it runs along the anterior aspect of the leg. This nerve provides motor innervation to muscles of the anterior compartment of the leg, including the tibialis anterior muscle, the extensor hallucis longus, the extensor digitorum longus, and the extensor digitorum brevis, and fibularis tertius. It also provides a spot of sensory innervation to the dorsum of the foot, between the first and second toes. Alright, it's time to leave the sciatic nerve now and to discuss some other branches of the sacral plexus. It's worth noting that the sacral plexus gives off quite a few nerves, but for today, we're just going to focus on the ones that we can see in this illustration. The first branch we're going to talk about is the superior gluteal nerve. This nerve is formed by the posterior divisions of spinal nerves L4 to S1. and leaves the pelvis via the greater sciatic foramen to enter the gluteal region. If we add some musculature, we can see that the superior gluteal nerve emerges above the piriformis, unlike the sciatic nerve, which emerges below this muscle. The superior gluteal nerve provides motor innervation to the gluteus medius, the gluteus minimus, and the tensor fasciae latae muscle. If we have a superior gluteal nerve, then we must have an inferior gluteal nerve. This nerve is formed by the posterior divisions of spinal nerves L5 to S2, and like its superior sibling, leaves the pelvis via the greater sciatic foramen. However, like the sciatic nerve, the inferior gluteal nerve emerges below the piriformis muscle. This nerve provides motor innervation to the gluteus.
Like, this is another thing that I want to mention. Like every visit I've been to has been like, yeah, you have back pain, but like they won't tell me. Like they'll tell me I have like lumbar or what is it? The like T portion of the spine. I can't remember exactly what it's called, but they'll be like, yeah, you have that pain, but they won't like mention like a vertebrae, and like I point to like a vertebrae on like my back, and I'm like it hurts right here, and I have like a lump on like directly on my spine. There's like a lump on one of the vertebrae, whatever one that is. I don't know. They never like mention any numbers for what it could be, like to identify it so far. They're just like, yeah, you have back pain and that's it. And it like kind of frustrates me because like I've seen videos for like to do stretches, and like what stretches, do for like what part of the spine or whatever, and then like some other stretches get like I'm not gonna say that it goes by like each vertebrae, but it will it targets like a specific area on my back, but my back is like hurts so much that pretty much from like the whole area from like middle to lower is always in pain, and then from like time to time like the upper part of my back around the spine area is also in pain. So I have like all that going on like around my spine area all throughout the day and night. It just doesn't stop, and it doesn't matter like what position that I'm laying in. And now that I'm like watching this, like they're just covering like pretty much the leg or the glutes, the legs, and the feet, and that's it. And yeah, I do have pain and tingling sensation down in my feet, but like how the fuck does this relate to what goes on in the back?
Maximus muscle. The next branch of the sacral plexus we're going to talk about is the pudendal nerve, which is formed by the anterior divisions of spinal nerves S2 to S4. The route of the pudendal nerve is a little bit unusual. It leaves the pelvis via the greater sciatic foramen and then enters the perineum via the lesser sciatic foramen. This nerve gives rise to branches that innervate the external genitalia, the skin of the perineum, and the muscles of the perineum, which is this diamond-shaped region you can see here highlighted in green. The last nerve of the sacral plexus we're going to talk about is the posterior femoral cutaneous nerve, which is formed by the anterior divisions of spinal nerves S1 and S2 and the posterior divisions of spinal nerves S2 and S3. The posterior femoral cutaneous nerve leaves the pelvis via the greater sciatic foramen and courses down the posterior aspect of the thigh. It provides sensory innervation to the skin of the inferior half of the buttock, the skin of the perineum, and the skin of the posterior thigh and the proximal posterior leg. Interestingly, it supplies the greatest surface area out of all the cutaneous nerves. All right, now that we're familiar with the sciatic nerve and its branches, let's get clinical. In today's clinical notes, we're going to be talking about sciatica, which is irritation of the sciatic nerve due to rubbing or increased pressure. The most common causes of sciatica is lumbar disc herniation, which can place increased pressure on its spinal nerves, which form the sciatic nerve. Another cause is spinal stenosis, where the vertebral foramen and spaces between the vertebrae get smaller, pinching the spinal cord and the nerves around it. Sciatica can also be
Okay.
caused by tumours within the spine or a back injury.
All right, that's
Patients may
that's fucking
present
scary.
with pain, tingling, numbness, weakness in their buttock, the back of their legs, their feet, and even their toes. It's worth noting that sciatica only affects one side of the body. Sciatica will usually resolve itself in 4 to 6 weeks, but it can last longer. Symptoms can be managed with exercises and stretches, as well as painkillers. Before we bring our tutorial to a close, let's quickly summarise what we've learnt today. We saw that the sciatic nerve originates from the sacral plexus, which is formed by the lumbosacral trunk and the spinal nerves S1.
That's something that I asked them too. I was like, is like just different doctors that I visited. I'm like, can this be caused by like some sort of cancer or whatever? And they came back and they said like everything that we looked at, it doesn't show any type of tumor growth anywhere, which, you know, if that's not the case, then good, but what the fuck is it? This thing said like 4 to 6 weeks and it's been over a year and nothing has changed. It's only gotten worse. And I'm still like, I can't run. I have no ability to like run right now. And I used to do that shit all the fucking time. I used to be so fucking athletic and now I'm just, I don't know, like an old man or something. It doesn't make any sense to me.
S1, S2, S3, and S4. We then looked at the sciatic nerve and its anatomical course. We moved on to look at the branches of the sciatic nerve, starting with the divisions, which are the tibial division of the sciatic nerve and the common fibular division of the sciatic nerve. At the apex of the popliteal fossa, the sciatic nerve bifurcates into the tibial nerve and the common fibular nerve. The tibial nerve has several branches, including the crural nerve, which gives rise to the lateral calcaneal branch, and the lateral dorsal cutaneous nerve. The tibial nerve also gives rise to the medial plantar nerve, the lateral plantar nerve, and the medial calcaneal branch. Whereas the common fibular nerve divides into 2 branches, the superficial fibular nerve and the deep fibular nerve. Next, we looked at some other nerves of the sacral plexus, starting with the superior gluteal nerve and the inferior gluteal nerve. Then we looked at the pudendal nerve, followed by the posterior femoral cutaneous nerve. We then concluded our tutorial with some clinical notes about sciatica. And that brings us to the end of our tutorial on the sciatic nerve and its branches.
Okay. Alright. I guess that was a good video. I mean, it was more informative than like most of what I've watched, I want to say. Besides like doing stretches and shit. I kind of wish it went more into like the spine. But that's the thing, like every time I look up something for like sciatic nerve pain and I try to find something for spine, except for one thing, and I haven't been able to find that on like YouTube or like any, like I think it was on WebMD or something, and it was like, it looks really fucking painful. Let me see if I can pull it up real quick. Open new window. No, it's from like Mayo Clinic, but it's basically like this right here, where it shows the lower vertebrae does that say? Yeah, compressed spinal nerve, which I mean, I probably do have compression in my spine. And I think something else they said was that I had, the fuck was it? Um, Degenerative, like disc disease. So, like, my spinal disc are deteriorating, um, over time, which I don't know if that just happens with age. I did look it up. Like, I tried to ask them, and I also like did my own research on it, and it was like, some of this just comes from age. But they weren't like, it's like severe, or like, uh it's not like happening at like a fast pace. So maybe it's just because I'm getting older. But I mean, from like the left side of my back where like everything is pulling from, like, I want to say that that matches kind of what I feel, but it's like higher. It's like around this area. And that's what I don't understand, is like everything around the area where I feel pain at, I go and I look it up, and it's you know, like the only thing that makes sense is like maybe, I guess, a herniated disc or something. And when they did like test on me, and they were like, no, we don't find that. Um, so it must be some type of nerve damage, I'm guessing. Okay. Um, see, the other video I wanted to look at was, yeah, this is something else that they did. They started me on like anti-anxiety and depression meds, which I do have anxiety and depression, but um, uh, besides a few years ago, like, I was never on any medication for it. But they were like, yeah, try taking this because this can help with back pain. So far, I haven't felt any relief from it. Anyway, let's see what they say.
Hi, I'm Dr. John Shim, and today I want to talk about a very uncomfortable subject for many of you. It's about depression and its relationship to back and neck pain. Right now, it's the holiday season, and many are preparing for traditions including family gatherings, gift exchanges, and parties. The hidden truth is it's a very stressful time of year. Pressures of cost, expectation, and emotion can actually cause depression. The feeling of depression is often hidden during this time, but can be expressed through frustration, difficulty sleeping, changes in eating habits, and increased heart rates and blood pressure. Unfortunately for those with neck and back pain, it can also make it worse or precipitate an episode. As we already know, there's a very direct relationship between chronic pain and depression. Both can trigger each other. For those who have chronic pain, I often recommend they see their primary care doctor and discuss use of medications, including antidepressants. There should no longer be a stigma about this treatment in our society, but still some cultures frown on those who seek help. As a physician, I say we must encourage our friends and families to get evaluated with their concerns. Other ways to prevent stresses from triggering more pain and more depression include the same common sense things we have discussed over and over again. Get your exercise. You feel better. They're actually a release of endorphins, those chemicals that make you feel better. Keep your weight down. Even though it's obvious, we still let ourselves go during the holidays. Weigh yourself every day. Track and trend. Avoid situations that increase your stress emotionally, physically, and financially. Again, an obvious recommendation, but as many will say, difficult to execute. Stay engaged in your favorite activity or hobby.
That's something else I can't do. I can't fucking paint. Like, painting, I love to paint, but painting, it's so fucking painful for me right now. I did a Hollow Knight painting not too long back, just to see if I could, you know, if that's something else that I could do. Well, I can't really work on much physically, but my back was in so much pain through that, and I'm like, I cannot sit here and do another one because it's just excruciating for me um to like have my arm elevated for so long, or even if I sit down to like lean over and actually um reach out. I guess it's like the motion of like going back and forth so much with the from the from paint to like canvas, it just hurts so fucking bad.
Stopping the one or two things that you find fun can become a very vicious cycle. Sleep at the same time every day. Your body likes to keep a rhythm, it regulates you. Avoid excessive alcohol consumption. Paradoxically, alcohol makes you sleep less effectively. If you feel overwhelmed by stress, sadness, and despair, get help from a physician. While family and friends may mean well, sometimes their advice may be the exact opposite of what you really need. I'm Dr. John Shem. I wish everyone an excellent holiday season. Please do not stress about things you cannot control. Reach out to those who allow you to equally laugh or cry. Reach out to those who really love and care for you. Peace to all. Thank you.
Okay. I thought maybe it was gonna go into like some medical science about how depression meds help back pain, but it didn't. Alright. It's still decent advice though. Let's see. I can probably, I don't know if stream is gonna stop. If stream stops, I'm sorry. But I'm